than me,
Okay.
but that's okay. We're all friends here. So, welcome to the UHP Network monthly webinar number 2. So obviously the second one in our series that's sort of represents the end of early access here. But the thing I want to make very clear that the UHP network is the only source where you can learn directly everything that you need to know about my unified model. If you're interested in my work and what I do, and if this is your first exposure to my work, my name is Bill Hartman, and I constructed the Unified Health and Performance Continuum model with the intention of creating a more coherent representation of movement for anyone who is involved in movement-based professions. Real quick, since I brought it up, um, tonight's topic is going to be about ramps, wedges, heel elevation to promote the various representations of propulsion via the foot. And then we're going to talk a little bit about upstream mechanics as we go through this. But as always, the goal behind all of this information is to make more coherent decisions based on the desired outcome and to avoid the common errors of application. Real quick, a little bit about the network. We're just wrapping up early access, but I want you to understand that there's going to be continued free content forever. You will have access to ongoing information. You're going to get a quarterly webinar just like we're doing today. Every month you're going to get a new blog. Every month you'll get a free office hour. So this is live office hours. So this is a live Q&A that we do on the network. You'll have access to the free Model 101 course, the free decision-making course. And then if you pass those, then you get access to the UHPC Model Q&A forum where you can ask ongoing questions. You'll also get access to once a month you get access to a free coffee and coaches conference call. So once again, always going to be free content available to you. For those of you that are more serious practitioners, want to get deeper into the model and so on, we now have an option for you. And so this is going to be the UHP Network Plus. So again, very practitioner driven. In fact, you're going to have an influence as to what type of content we are presenting and working our way through. So additional benefits to being in the Plus. You're going to get a free 4-hour Evolving the Model performance course. So we haven't really talked too much about that. But that is going to be up and running very, very soon. You're going to get access to Plus, I believe, this weekend. You get the free Model 101 course if you haven't taken that already. A lot of people already have. You get the free decision-making course. You're going to get the first opportunity to apply to the next intensive, which is probably going to be later this summer. You're going to get a free monthly webinar like today. So you're going to get 8 more than the free content. You'll get a weekly live office hours rather than just once a month. So you're going to get 3 more of those. We have case study learning spaces that you'll be able to access. We have targeted discussion forums by context. You'll get all the coffee and coaches conference calls plus the backlog of those calls. So we're on call. I think we did 202 last week. And so there's going to be 400 hours of those calls. You'll get direct access to the UHPC model updates. You're going to get 10% off of all future courses. You'll get entered into a monthly lottery where we're going to pick a name out of the proverbial hat, and you'll get a one-on-one mentorship call with me. You'll have access to the networking forum, so you'll be able to communicate with all of the other Plus members, and then you're going to get access to an ongoing open study hall. So quite a bit of stuff that's going to be associated with the Plus, because we're really going to push this practitioner concept rather aggressively. If you have any questions about that, there's going to be a space on the network where you can ask those questions. But again, I think this is going to be available to everyone this weekend. All right. So tonight's webinar, just to give you a quickie outline. So we're going to talk a little bit about simplifying the foot. So we're going to break the foot into basically 4 pieces, make it really easy to digest. For those of you that were already on the network, then you've probably already gone through some of your review that I asked you to do earlier this week. We're going to review the propulsive foot, so you understand each phase of propulsion. And then we're going to break this thing down into early propulsive bias strategies, middle propulsive bias strategy, and late propulsive bias strategies as to how we're going to use these ramps and wedges and steps and such. And then we'll look at some common errors that are associated with these things, because there's going to be people that are going to try to do things, think they're doing something that's effective, and they actually might be causing some compensatory strategies or actually interference unknowingly. And so we're going to cover some of those. And then I'm going to show you some examples of what you can actually do, because we got some pretty cool before and afters that are associated with this. So let's simplify the foot. So we're going to break the foot into basically 4 pieces. We got 3 divisions. So we're going to look at a rear foot, a midfoot, and a forefoot, and then we're going to separate the toes out, because we got to talk a little bit about that differential at the first metatarsal phalangeal joint, because it's going to be an influence, especially when we get to discussions about the late foot, because it creates a little bit of confusion as to what shape that we're actually promoting under those circumstances. But this is going to be your simplified division. So when I talk about rear foot, it's everything behind the first red line, and then as it moves forward towards the forefoot, it goes midfoot, forefoot, and then of course the toes. Now, definition of propulsion: moving forward through space in contact with the medium. So people are going to say, okay, Bill, why do you always talk about propulsion? Why don't you just say walking? Why don't you just say gait? Well, I've worded this definition specifically because what we have to understand is that we're not just talking about walking or running when we're talking about propulsion. We're talking about moving forward through space in contact with a medium. So I could talk about swimming in the same way that I would talk about walking. I can talk about rolling across the ground the same way that they would talk about walking across the ground. All I have to be able to do is make sure that I am moving forward through space in contact with the medium. So exercises themselves are actually going to fulfill the requirements of certain elements of propulsion. And then that's why we're going to be very, very specific about this. So without further ado, we're going to talk about the foot. So this is going to be sort of a walking perspective, if you will, and then we'll get into some of the exercises. So this is a foot, and we're basically looking at 3 phases of propulsion, so you can formulate a picture in your head. So if you're taking a step forward with your right foot, this is basically what you're looking at. In each phase, there's going to be a shape bias, and there's going to be a degree of downforce into the ground. And there'll also be a position of the center of gravity relative to the foot that's going to help us define each of these phases. And so there's also going to be a difference in the ability of the tissues to absorb and release energy. And so in each phase, this is going to be distinguishable. So if we look at the early propulsion, so this is early P. So this is the energy absorbing phase. And so this is where we start to see the first superimposition of internal rotation. So we have an external rotation bias of the foot, and we start to superimpose the internal rotation. Now, real quick, what do I mean by superimposition? What I'm saying is that both ER and IR are there. So both internal and external rotation are present and visible. So if I have 2 hands like so, we can see 2 hands. And even if I move them closer together, we can still see that they're distinguishable as right and left. And so what we have is the ER shape bias, and then we have the IR downforce, which is pushing down into the ground. In early propulsion, the center of gravity is going to be behind the foot. So most of your mass is actually behind the foot, which is going to keep the center of gravity posterior. You can also see that no matter how hard you try, you cannot maximize the downforce into the ground. So again, this is the first accumulation of internal rotation from distal to proximal. So if we go to middle propulsion, so you can see that the tibia is now translating up and over the foot. As a change in the representation, we're also going to see a change in the shape of the foot. But this is the energy absorbing phase of propulsion that's going to be associated with a superposition of internal rotation with the center of mass over the ground contact. So what do I mean by superposition? So let's use the right and the left hand concept again. So if I was to move my hands together and stack them to where you can only see one, that would be what we would call a superposition. So where we initially had two different hands available, we can now only see one. So that's basically what middle propulsion is going to look like. So we have a superposition of ER and IR, but only the IR is going to be represented under that circumstance, at least visualized. So this is where we're also going to see the equal and opposite action reaction that would be associated with Newton's third law. Because basically what we're doing is we're creating a collision in middle propulsion. So this would also be where. I'm gonna stop for just a second. Can everybody mute, please? This is where we're also going to see the maximum amount of compression in context. So the time is actually going to come to a stop. We're gonna maximize the amount of energy that we can actually absorb under this circumstance. And once again, center of gravity is over the contact. So we're pushing down maximally. Now, when I say maximally, walking has a certain amount of downforce that's going to be associated with it. Sprinting would have a certain amount of downforce that's associated with it. Rolling would have a certain amount of downforce that's associated with it. So we're talking about in context under those circumstances. As we move into late propulsion, this is going to be the energy releasing phase of propulsion. It's going to be associated with a decreasing representation of the internal rotation that we saw in middle P, but we're also going to see a return of the increasing external rotation representation. So external rotation is going to reemerge under this circumstance, okay? The force application is going to be in a decreasing state. So when we have the reemergence of ER, we have to take away some of the IR. So once again, as we saw in early where we can't push down maximally, we're going to slowly start to see the IR dissipate. So late propulsion actually begins with a great deal of downforce and a great deal of internal rotation. That's going to be kind of important once we get to working with some of the implements in the gym. In this circumstance, the center of gravity is now going to be in front of the ground contact. So important to differentiate between the ER bias in early and the ER bias in late. So we can distinguish that by energy absorption versus energy release, but we can also distinguish it by the position of the center of gravity as we are moving forward. So I got Eric to do a little walking in the gym. And we took some snapshots here to give you an idea of what we're actually looking at in real time. If we take a look at the very first picture to the left, so if you prefer old school representations, what you got on the left foot is often referred to in gait literature as loading, and then the back foot would be indicative of pre-swing. But in both circumstances, the degree of internal rotation that we have actually in contact with the ground is very, very small. So what we're going to see is this accumulation of IR on the left side, which is going to bring us to early propulsion. And so one of the key elements to be able to recognize early propulsion is when we get the first metatarsal head to come down to the ground. Up until that point, most of the way that the energy propagates through the foot is through gravity. At this point, first metatarsal head hits the ground, and what we're going to see is we're going to see that internal rotation magnify itself from distal to proximal, and this is where we're going to start to see all the turns inward relative to the initial ground contacts, which were ER biased. Then we move through middle. This is where we go straight down into the ground, and you can tell that. So this is our collision with Earth. Earth is pushing straight up on us. We're pushing straight down into the Earth. So this is our point of maximum compression. This is where our time would stop. And this is where we're then going to see the conservation of momentum take effect. And that's going to allow us to continue to propel forward into the late representation. So we can see actually this is a really good representation of the late foot on the left side. And we've got the center of gravity in front of that ground contact. Now, I hesitate to call max propulsion a phase because it's really fast. Like, and we're talking about really fast. So this happens very, very quickly, but it's the point in time in propulsion that will be associated with the initial release of stored energy and the reemergence of the external rotation. Um, but it's still important because this actually takes place as the heel starts to leave the ground. So this is going to be important again as we start to look at the late propulsive foot representation when we're talking about exercises and activities and drills, because the shape of the rear foot is going to be very important under this circumstance. But if we were to try to identify where this actually takes place, because it's so quick, it's going to happen about right there, which would be right between the end of middle and the very beginning of late P. So this is where the heel is going to break the ground contact. And I gave it a shot. It's pretty close. So I was walking across the gym, took a little video, and this will give you a pretty decent representation of what we're talking about at the point of max P. So we have the maximum amount of internal rotation in the system at this in this moment in time. And as the heel breaks from the ground, we're going to start to see the re-ERing. And so this is actually a twist that actually goes through the foot. And this is where we're going to start to see the differential in connective tissue behaviors going from an expanded representation to its energy releases. So it's actually getting very, very stiff through the foot in this circumstance because we have to have a late propulsive foot to push off of. Now, one of the things that we need to discuss here is the difference between force and velocity, because at this point, when we're pushing into the ground, there's still a great deal of internal rotation present. The force is very high. And people say, well, if this is the biggest release of energy that we need to sort of concern ourselves with, why aren't we moving very quickly? And we just need to know a little bit about the difference between force and velocity. So we can look at this force velocity curve. And one of the things you want to recognize is that at the highest of forces, velocity is low, and at high velocity, force is low. So they are at opposite ends of the performance-related spectrum. And so this is why we'll see people that do amazing things at high velocities, and then you take them into the weight room, and they're not the greatest force producers in the world. And so I can be biased towards high force, and I might have a certain element of speed or velocity, but those with the greatest capacity to demonstrate velocity tend to not be the highest force producers. They can do it over a short moment in time, but we wouldn't compare, say, a power lifter that can squat 1,000 pounds to the highest level of sprinters. Okay, so now we've got a general idea of what we're looking at in early, middle, and late propulsion. Now we got to go in the gym and we want to take those representations and we want to construct activities that are going to help us enhance each one of these phases. So early propulsion bias strategy, a quick review. So we got an ER positional bias. We are superimposing internal rotation. So this is the beginning of our energy absorption phase. Center of gravity is behind the foot, and then the connective tissue behavior will be yielding. So this is the energy absorbing phase of the propulsion. So a little image to give you an idea of what we're looking at. So again, center of gravity behind the foot. We've got full ground contact at this point. So we've got a full heel contact. We've got the metatarsals on the ground, center of gravity's behind, and we're actually stepping out into an early propulsive bias under this circumstance. The heel is relatively heavy in comparison to the forefoot under this circumstance, because once again, I can't apply a maximum amount of internal rotation under this circumstance. The mortise formed by the tibia and fibula is actually in a narrowed position under this circumstance, which is one of the reasons why this would be one of those situations where if we were going to pick a place to sprain an ankle, this is actually one of the best places to do that. So if I try to produce a maximum amount of downforce in this circumstance, the mortise is actually more shallow. I'm in an ER bias. It's very easy for me to continue to roll into an ER bias, and that would result in my sprained ankle. So in the gym, what we're going to do is we're going to take our ramp and we're going to elevate the heel relative to the forefoot. But it's very important that we keep the heel and forefoot on the same level. We want to have an even ground contact throughout the foot. So we've squared the heel and we have all the metatarsals down on the ground. This is what allows us to continue to superimpose the internal rotation from distal to proximal. But because we've enhanced the bias of keeping the center of gravity behind the foot under almost every circumstance, even if we translate the tibia forward, we're still keeping the center of gravity behind the foot. The heel is still heavy relative to the forefoot. We're not going to translate internal rotation all the way through the foot. And this is going to help us to hang on to this early propulsive bias. We can even take the tibia as far forward as we want, and we're still going to stay heel heavy under this circumstance. Now, does that mean I can't go to the forefoot? Absolutely you can. Does that mean I can't break the heel? Absolutely you can. But you're no longer in this early propulsive bias, because what we're hoping under these circumstances, when we're trying to capture a representation of early propulsion, is that we're going to get a distal to proximal representation that's going to translate itself up through the system. And so what this is going to look like, this is a right step forward. If we take a right step forward, what we're looking at is a yield that's going to take place in the posterior aspect of the pelvis and the posterior aspect of the thorax. And so this is where these delays would occur under this circumstance. This is where we start to slow down. So this is primarily connective tissue behaviors that are creating the expansion to decelerate this side. This is essential for eventually coming to a stop. This is our storage of energy that we're going to use to release energy if we continue through propulsion. This is how we slow down one side to begin to make turns. So that's why the early propulsive bias then becomes so important. If we were to look at, say, a bilateral symmetrical exercise where we're going to try to capture early, we would use something like a heels elevated, or ramp elevated rather, goblet squat under this circumstance. The displacement of the load anteriorly also promotes the delay strategy. It enhances our strategy that goes up into the thorax. We've got the early propulsive foot position. We've got a center of gravity that's staying back behind the ankle. We're heavy on the heel and relatively lighter on the forefoot under this circumstance. So this is actually a really good representation of how we would use the ramp to create the early propulsion. Okay, let's moving to the middle propulsive bias. So quick review. We are positionally internally rotated. So there's more internal rotation here. We have the superposition of ER and IR where only IR is going to be recognized in this circumstance. Center of gravity is going to be directly overfoot. This is where we're going to maximally apply force into the ground. This is where we're going to ramp up the absorption of energy. And again, Sir Isaac comes into play where we get the action reaction under this circumstance. We're going to see conservation of momentum if we continue through this phase. Now, I've got an early propulsive foot set up on the box under this circumstance. And so let's just say that this is the lead leg in a right foot forward split squat. And so the lead extremity is going to be biased towards ER by elevating the foot upward. So external rotation is up and away from midline. So I position the foot up. I am now increasing the bias towards external rotation. So that means I have to take away some internal rotation. So if we're looking at a split squat, a typical split squat is going to be biased about 55% on the front foot, 45% on the back foot. I have just reduced that load on the lead leg to whatever it may be, depending on the height of the box. And so because I'm reducing the ability to apply the IR, I can actually move through middle propulsion with less IR demand, and I'm less likely to produce an internal rotation compensatory strategy. Because if I can slow down the way that the internal rotation moves through the rear foot and midfoot, remember these are gravitational. And so if I slow this down, I have a greater access to relative motions in the rear foot and midfoot because I have just given it time to do so. So again, we're slowing down the propulsive phase to allow us to access the internal rotation. So as I move the tibia over the foot, this is going to start to look a lot more like a true middle foot, But again, because of the elevation, I'm holding on to some of that ER bias, which takes away some of the demand for downforce. Now, this allows the IR to continue to propagate forward. So we've gone through the rear foot, and now we're starting to access IR that goes through the midfoot. But again, reducing the load as it moves forward. As I translate the tibia all the way through the foot, now we've gone through the midfoot, and we're going to see actually the distal first metatarsal is going to have to start to ER. Now, because we've elevated the foot, we're going to actually stop that translation from occurring. So we don't have to concern ourselves to a great deal that we're going to bypass the forefoot. Can you do it? Absolutely, you can. But we can actually monitor that in real time as a coach to prevent that from happening. So this is going to give us an opportunity to move a lot of IR through the foot in a reduced downforce situation. And so we can progressively increase someone's capability of capturing relative motions without the concern of driving the IR compensatory strategies. One of the strategies that you can actually use in the gym is like a recline position, or in this case, we've got a suspension trainer. So I can start myself in an early representation of propulsion. And as I descend, I can control and monitor how much I'm allowing the center of gravity to move forward over the foot. So I can translate the tibia over the foot. I've got full ground contacts under this circumstance, but I can move my center of mass forward over the foot and start to capture the middle propulsive representation through the foot. Same principle as we applied in the elevation. I'm just controlling how much internal rotation I'm allowing to propagate forward. One of the things that we want to recognize as we're translating the tibia over the foot, we're capturing the middle propulsive representation from distal to proximal. I have a progressively increasing amount of internal rotation that is moving from distal to proximal. So my arrow here is representing sort of like the dead center middle representation where the tibia is starting to turn inward. If I continue to translate that tibia forward, I'm going to see the internal rotation move up towards the knee and up through the knee. I'm also going to see the amount of internal rotation propagating through the foot hit the end of the distal first metatarsal. That's actually going to have to move in opposition because the big toe is going to move into IR, which means that the proximal side of that joint, the distal first metatarsal, is going to have to rotate towards external rotation. So in this circumstance, for us to create this representation where we're maximizing the amount of internal rotation proximally to the knee, we're going to flip our ramp around under this circumstance. So this is where we're going to use a heel lower than forefoot on the ramp. Once again, we want to make sure that we've got a full representation of ground contacts under this circumstance, because this is what we would see during middle propulsion. We can translate the tibia forward over the foot and progressively increase the amount of IR. But once again, I'm going to produce a self-limiting activity under this circumstance, but I am going to be able to propagate it more proximally. That's why you would use this strategy. It's not just to produce the foot, it is actually to propagate the IR from the foot and ankle upwards towards the knee. If I push this too far forward under this circumstance, this is where I'm going to start to see an increase in the midfoot load. So this is what we're going to have to monitor for, because there is a concern that I can push this forward too hard and I can actually shove the midfoot down, and that becomes an IR compensatory strategy. And that's just connective tissue behaviors. That's not relative movement that we want to see propagating from distal to proximal. Now, this is actually pretty rare in this circumstance, because there's something that's really cool that happens when we use this orientation and we select the appropriate exercises, because what's going to happen typically in this circumstance is we're going to have an active tibialis anterior in this circumstance, which is actually going to internally rotate the proximal aspect of the tibia, and it's actually going to hold and stabilize the proximal end of the first metatarsal, which is going to prevent the midfoot from collapsing under the pressure, as long as we have this active TA. Like I said, the nice thing about this is that we rarely have to coach this, because under most circumstance in this position, we're going to see this automatically kick in. And if you've ever done like an early propulsive wall squat, like so, we've got the 4-foot elevation, we've got the foot on the ramp. All you have to do is coach them into the 90-degree position at the hip. We're going to have the tibia translating forward over the foot, and this becomes self-limiting because we got a pretty solid stop there. We get IR that propagates to the midfoot under this circumstance. We've got the active tibialis anterior, and the arch can't go down any farther. And so we got a, like I said, we get a nice stop. And so we really don't have to coach that. Doesn't mean you don't monitor it. Doesn't mean you can't still screw it up. It's just, like I said, it's one of those activities that's very useful because we don't have to do a lot of coaching under this circumstance. Now, we talked about how that distal first metatarsal has to ER relative to the IR that's propagating through the foot, and then the big toe is going to IR. So in a lot of circumstances where you see somebody that has this really strong ER to IR representation that goes from midfoot to forefoot. So this is going to be represented in the first metatarsal. We need a specific strategy to address this. So this is where we're going to pull out the 4-foot wedge. So with the 4-foot wedge, what we can do is we can actually, and I'll show you the back side here in just a second. We can square the heel to the ground, and then we can create the ER representation through the 4-foot with the heel squared to the ground. And what this is going to do is this is going to allow us to finish the middle propulsive foot. So we have the IR that's propagating. It hits the first metatarsal. This has to counter-rotate into ER relative to the big toe. Now, it is imperative that you do this as I describe, because this is one of the things that a lot of people are just screwing up because they've seen somebody use the wedge and they're not really sure what to do here. You'll notice that the first 3 metatarsal heads are on the wedge. 4 and 5 are actually on the floor. If you don't put 4 and 5 on the floor, you cannot square the heel to the ground. So you will not propagate the IR forward through the foot, and you will not create the ER representation of the distal metatarsal, and you will not get the shape change that would be associated with middle propulsion. So as I spin this around, this is the rear foot squared to the ground. So this is the first 3 metatarsal heads on the wedge. 4 and 5 on the ground. This is how you get the IR to go through the foot, and then you get the ER at the distal metatarsal. Now we'll go into late propulsive bias. So quick refresher. ER positional bias starts to reemerge. The IR representation is reducing. It's very strong at the beginning of late propulsion, but it does reduce. So you think about the foot that's going to be leaving the ground as you have propelled yourself forward. It's leaving the ground because we are reducing the amount of force application downward. Center of gravity is way in front of the foot, and energy is releasing at this point. So we've loaded the connective tissues, we've stored a ton of energy, and this is like the slingshot effect and the conservation of momentum that we talked about, where we have that collision at middle P, and then the energy is being released and allows you to propel yourself forward. So this is the overcoming connective tissue behavior. So these are stiffer connective tissues under this circumstance. Now, this is really interesting because typically what we're going to see in a late propulsive foot is the heel is actually off the ground. It is unsupported in this circumstance. However, in the circumstances that we're going to use this in the gym, we're actually going to support the heel, because what we're trying to do is we're trying to hold on to the ER'd position of the rear foot relative to the forefoot. So by elevating the heel in this circumstance, even though it looks like the heel is squared to the ground from the posterior view, the forefoot is actually twisted again into IR. So the rear foot is actually ERing in this circumstance. The cool thing about this is that because the heel is still supported, it allows us to continue to apply downforce. So we have relative motion that is going to be maintained in the rear foot. So we'll be able to move the ankle, but as the energy is released in the forefoot and the midfoot, it's going to hold on to the E-yard position. So we actually have a very stiff representation of connective tissues through the arch of the foot and into the toes. This becomes very useful because in certain activities and exercises, as we would incline this forward, we're never really maximizing the amount of tibial translation forward because of the heel elevation. So we actually have room to translate the tibia. We can access internal rotation through the rear foot, and we'll be able to perform activities with some measure of force production. For instance, a heels elevated squat will still be able to apply a decent amount of iron to the ground. So we can still work on force. We can still work on maintaining relative motions throughout the system, rather than shifting ourselves into situations where we're maximally applying long duration IRs into the ground, which is going to steal a lot of our relative motions over time. Now, let's talk about common errors. So I've seen people try to do this where they'll use a ramp and they're going to put the forefoot on the ground and they've got the heel elevated. The problem that we run into in this circumstance, if you recall, when I was talking about the heel elevation, we want to square that heel and we want the heel fully supported in the late propulsive representation in the gym. When you put your heel on the ramp, you've only got a point of contact on the heel. And what happens is we don't have enough internal rotation in the rear foot to allow the tibia to translate forward. So if we do translate the tibia forward under this circumstance, what's going to happen is we're going to create an IR compensatory strategy through the midfoot. And so again, this is going to be connective tissue behaviors. This is not going to be relative motions and may not be desirable. So for instance, if we have an athlete or a client that is already using this IR compensatory strategy, and we say, well, we're going to put him in a late representation to help him to reduce this during performance, this strategy will not work because as he translates the tibia forward, he's going to push down through the midfoot. So you're actually reinforcing the strategy that you're trying to alleviate under this circumstance. So this is why we would want a squared representation of the heel in the late propulsive. So when we talk about heels elevated, we are talking about only elevating the heel on a flat surface. This would not support our representation of the late propulsive foot. This is a representation. It was a great attempt at creating the forefoot wedging that we talked about, but now the wedge is too high. And so what happens here, we got a similar problem that we just saw when we tried to use the ramp for the late propulsive foot. We have too much ER. So it lifts up the metatarsals. We lose our medial heel contact. So now we can't propagate IR through the foot. So if we were to translate the tibia forward under this circumstance, once again, if we can move it forward at all, and it doesn't deviate away from midline into ER, if it does stay over the foot, you're only going to create an IR compensatory strategy in the connective tissues through the midfoot. Another strategy you may see used in the gym that is not what it seems is to create this representation of what is unfortunately going to be referred to as a pronated foot. So this is definitely an IR representation. We definitely have full contacts under this circumstance, but we don't have any relative motion in the foot in this case. So we have a foot that's behaving as one piece. The unfortunate circumstance, because this is an IR compensatory strategy of the entire foot, we actually create the opposing strategy in the tibia. We actually get tibial ER in this circumstance relative to the IR of the entire foot. So if we were to jump on this platform or push off this platform as if we're performing, say, an outside foot cut, we're actually not going to be able to promote a knee position that would be ideal to absorb energy because we're actually going to create an ER'd tibia under this circumstance. So Proximally, what you'll see is you'll see the tibiofemoral ER and you'll see the distal femoral IR in this circumstance. It's just you'll see a magnification of the tibiofemoral ER. That is actually a late propulsive knee. So you're actually bending the knee against the normal mechanics. So if you're a big fan of producing any form of medial knee pain, if you want to create a lot of stress on the ACL because you're going to twist that femur hard into IR relative to the tibia, meniscus, MCL, all of those are going to be on the table under this circumstance. This is the 4-foot wedge again, but this is not a wedge that is too high. This is actually the difference between putting the 4th and 5th met heads on the ground versus putting the entire 4-foot up on the wedge. So we get the same effect that we had when the wedge was too steep and we only had the first 3 metatarsal heads. So this is why the 4th and 5th met heads need to be on the ground to square the heel. 1, 2, and 3 are on the wedge to promote the distal ER in the first metatarsal, so we can actually acquire the completed middle propulsive foot. Much like we were talking about with the IR'd foot and the ER of the tibia, if we were to try to use the ramp in the opposing circumstance where we're going to actually capture a massive amount of ER through the entire foot, while we may have the contacts, we certainly don't have any IR propagating through the foot. Where we're going to see this show up is actually even more proximally than what we saw with the IR'd foot and the ER'd tibia. So this is going to translate the tibia into ER. The femur is going to follow into ER. So if you were thinking about the extreme example, this would be a cowboy walking in the door after getting off his horse, or a Harley rider that's been on a long ride. You're going to see the equivalent of an ER'd hip, an ER'd knee, and then you're gonna end up with an ER'd foot. So we don't get a whole lot of internal rotation at all. So if I was to try to bend a knee through this, this would be one of the more unfortunate circumstances. If you're a big fan of IT band problems at the knee, the accusation of IT band problems, I don't necessarily agree that they're IT band problems. They're IT band results more than anything else. Anything that would be lateral, LCL. If you were to bend this knee deep enough, you could end up with like a posterior lateral horn meniscus injury. So again, not a great choice under this circumstance. Unfortunately, where I see this foot position show up is actually not with the ramp, but it is the same circumstance. If you've ever seen somebody take a landmine and load it as such, where they're actually driving a tremendous amount of ER into the lower extremity. This is actually the same foot position that we just saw on the ramp. And definitely not a knee that should be bending. In fact, the hip isn't even capable of bending under this circumstance. So we're going to see a lot of anterior orientation driven here. And again, you're driving a lot of ER through the system. May not bother you today, may not bother you tomorrow, but eventually, if you continue under this circumstance, you're eventually going to see some sort of symptom arise. I'm going to jump ahead here. All right. So just like we were talking about with the heel elevated strategy on the ramp, if we try to put the foot on the ground and the 4-foot up on the ramp, we're going to end up with the same situation that we saw before. So because we have a limited ground contact through the heel, we'll never propagate the IR through the rear foot like we would typically see. So gravity doesn't allow us to capture the IR through the rear foot or through the midfoot. And so if we were to translate this tibia forward with the limited heel contact, we're going to stick this foot in a late propulsive strategy. And now again, we're going to drive the IR compensatory strategy straight through the midfoot. Again, connective tissue behaviors, not relative motions, typically not the desired outcome. I'm going to throw this one in here because it's interesting that people use this a great deal, but they're not attending to how this test is done. So this is your knee to the wall kind of a test that they would use for quote unquote traditional dorsiflexion. If we're not attending to the contacts of the foot, if we're not attending to the shape of the foot, and we're just driving the tibia forward, there'll be circumstances where we can drive connective tissue behaviors and we can move that foot further away from the wall and we can still make knee contact. We can twist the tibia in the wrong direction. We can bend the knee because we're going to create, if we create a tibiofemoral ER that is of sufficient degree, we can eccentrically orient vastus medialis, which will allow the knee to bend against the mechanics with absolutely no resistance. Not desirable. This is not what we're looking for when we're actually performing this test. It doesn't make it a useless test. It just means there's a whole lot more to it than sticking your foot on the ground and jamming your knee forward in an attempt to bend the ankle. Now let's look at a couple before and afters here. So these are some cool changes. Now, before I show you these before and afters, I want you to understand that these are not easy changes to make because some of these changes are actually bony adaptations that occur over time. So it takes a very committed client to make some of these changes. So this was a young lady, I believe when I started working with her, she was about 28 years old. She had had 10 knee surgeries. So she had 2 on the left and 8 on the right. So after her first knee injury, they basically went in every year and they would do a quote unquote cleanup surgery on her knee. She would go through rehab. She would do okay. She was never pain free. But what you're seeing here is this massive amount of ER that's going through the entire foot. So this is somebody that could not capture the ER as it propagates through the foot until it got basically to you can see the big toe. You can see how she's crushing her big toe into the ground. You see how fat the big toe is, and you can see the bend that's going through the interphalangeal joint here. So under this circumstance, you'll see the ER to IR twist in the knee. So this is what we were talking about before, where you have tibiofemoral ER relative to the distal femoral IR. And so she would come in with anything from patellar tendon pain to anterior knee pain, patellar, you could call it. She had a diagnosis of chondromalacia at one point. She had a meniscus tear at one point. So all of the medial knee structures were under load for a significant period of time. And so what we did is we basically just started working on bringing the IR through the foot. So if we look at the foot on the extreme left, this is our starting position. And then within about 4 weeks, 4 to 8 weeks, I think it was, is we're starting to see the change through the foot. And so you can see that we're starting to capture the IR propagate through the foot. So at about 4 weeks, she was almost pain-free. And at 8 weeks, she was in the gym and she was able to exercise for the first time in years without any knee pain. Fast forward about a year and a half. So I started seeing her in 2020. And by November of 2021, you can see the radical difference in the shape of her foot. You can see the shape change in her toes. You can see a massive degree of internal rotation. So by the time she got to this picture in November, she was actually playing in a intramural basketball league, and she was actually coaching women's basketball at this point. We've seen her intermittently over the last couple of years, just for follow-ups every once in a while. I catch her in the gym. She's basically behaving without limitations as long as she does her homework that allows her to maintain these shape changes in her foot. So this is a great shape change. So once again, this is somebody who is extremely diligent with their program, but you can see that this took some doing and it took some time to make this change. So this is actually somebody that had a rear foot shape change. So somebody that would spend an extended period of time with a downforce that goes through the rear foot can actually bend the rear foot into IR. The strategy in this circumstance is actually to use our late propulsive foot strategy. So this would be a heel elevation to square the heel. So this is an ER'd rear foot. Remember, we're ERing the rear foot. We actually have to rebend the calcaneus and then restore the relationship in the rear foot. So the primary strategy in this circumstance was to use the heel elevated and then using the active tibialis to control the middle foot. But again, you can see a pretty dramatic shape change from beginning to end here. This is actually the same day. So this is just teaching the strategy that actually slows down the propagation of internal rotation through the forefoot. So this is a front foot elevated activity that resulted in the ability to capture the internal rotation through the rear foot and propagate it more slowly through the foot and allow them to capture the heel contact. So this is a pretty decent before and after because it was the same day. Now, the cool thing about this is we were talking before about how we want to see these strategies propagate up into the axial skeleton. So if we look at it before and after of the same individual, we can see on the left, we can see the IR compensatory strategy on the left side. We were able to slow the foot down. We can now load internal rotation normally. We have a normal yield through the connective tissue behaviors on the left side. And so we see this posterior expansion on the left side and the restoration of the vertical dimension. So this is actually the ability to get airflow up into the axial skeleton. Now, there are circumstances where you may not be able to make these acute changes. And under these circumstances, we can actually use the same concepts, but now we're going to do this through application of tape or an orthotic. So that's why you would use those strategies, because we can't do it with shorter term exposures. And so in that case, we're going to use something that's of a longer duration. The things that I want to point out to you here. So again, this is propagation from distal to proximal. If you look at the abdomen in the before picture, so this is somebody that was AP compressed in the upper portion of the thorax, pushing downward, which is why you see the expanded representation of the abdomen. So you push down in the guts got to go somewhere. They're always going to go forward. So they're spilling over the top of the pelvis under this circumstance. And then you can see the AP dimension of the thorax that is getting squeezed because it's going to create the depressed look of the scapulae. We capture this normal representation of the propagation of energy through the foot. She's able to push down into the ground. She can pressurize the pelvis. We reduce the exhalation strategy at the end of exhalation. So we're actually able to maintain some of the volume at the end of exhalation. And then we see the AP expansion and the restoration of the vertical dimension. So this is one of the reasons why we want to value how we're influencing the foot from the ground up. If you're interested in more information, I suggest you get on the UHPC network. So this is just a couple of videos that are on there where we're talking about how we would mobilize the foot to propagate the IR. And there's also an extended version of this video on the network. I think it's about 7 minutes long, where it goes through the exercise sequence. So this is the kind of stuff that we're putting on the network for all of you. And so I encourage you to take advantage of that. Okay. So for those of you that are on the call, are there going to be any questions? So I'm going to stop my share. And if you go to the chat function, I would really appreciate that. And if you have a question, we'll answer them in the order in which they arrived, but we only have a few minutes left. So we'll do our best here. John, the degrees of the ramp do matter. You're going to solve that problem in real time. And again, you're going to learn how to monitor the midfoot in a lot of these cases. So if I can square the heel, if I can get the metatarsal head contact, first step. And then you want to make sure that as we translate the tibia, we've got the ramp elevation correct. We're not going to see that midfoot strategy show up. I draw some lines on the foot. I can't draw lines on those today, Chris. I will tell you what I'll do is I'll go back through this and I will draw some pictures on the images that I used, and it'll help people figure out what these where to look for these compensatory strategies. Stephen, happy to talk about footwear in a future webinar. Do I evaluate feet during and this is from Sean, do I evaluate feet during the initial assessment? And yes, I do. All of the pictures that I take will be in bare feet. So we're actually seeing the interaction of the foot with the ground. And all you have to do is be able to recognize the strategies that they would be using, which would help you determine where they are as an influence in their center of gravity in space, and then what strategies that they're using. If we had to do something in isolation, we could always do that. It just tends to not be much of a concern, because when we do have good relative motion in the foot, we're going to see the relative motion proximally. So always keep that in mind. You're going to see this in your chessboard. So the minute you start to see a chessboard with limitations, we're going to make the assumption that we're going to see similar limitations in the feet. And the first case study presented, hang on a second, boss. I gotta go back and look at my first case. Yes, Sebastian, for the EARD foot. Now, we didn't do it right away because the priority was to capture the IR from rear foot through midfoot, and then we finished with the forefoot mobilizations. Brian, the standard representation of standing should be dead center middle P. If you had full relative motion capabilities, you're standing in IR. You would have a nutated sacrum. The bias in the pelvis would be towards IR as well. So you're absolutely correct. It would be middle P. Paul is asking, can you please review once more why elevating the heel on a flat surface versus the heel on a ramp would produce a different result? So when you put the heel on the ramp, because the heel is going to be actually on a different plane, if you will, relative to the elevation of the ramp if the forefoot is down. So you have a single point of contact on the calcaneus, which will not allow the IR to propagate through the rear foot. So you're actually pushing down and creating an EARD representation. We need a medial heel contact to take place. So we have a lateral contact that moves to medial. So we're not giving up. We're not giving up the lateral heel contact. We're gaining the middle heel contact. That's what actually allows the IR to move through the rear foot. Because again, it's gravity that's doing this. It's not muscle activity. Sebastian's asking, are you pursuing most of these changes from a split stance position with appropriate modifications? So yes. Now, when we say a split stance, this is not, it's like we would see in a split squat. So what we're actually seeing, or what the stances that we're actually using are variations of staggers. So for instance, Sebastian, if I hold my hands up and I would have like a heel toe relationship. So we're going to work in these staggers because I have to do these from a position where I can actually control the position of the sacrum to oppose the present strategy. So I have to have an element of turn built into the activity so I can actually create the turns in the appropriate direction through the feet. What phase of propulsion would somebody be doing if the heel floating split squat? It's pretty straightforward that you're going to be in a late propulsive representation, but the amount of IR that you would have available under that circumstance would be significantly reduced. So keep in mind, if you were sprinting, that foot position would have a knee that is moving from a bent position to a straight position, not from a straight position to a bent position. So we would typically not want to reinforce that. I'm going to answer one more question here. So this is Justin. You had a picture of a wall squat with the forefoot elevated and said it's early IR bias, Justin. So we're bringing IR from the foot up. We're translating the tibia fully forward because of the knee position. This is the maximum amount of early IR that we would capture from distal to proximal. And so keep that in mind. The forefoot is elevated so we could get the IR to propagate from the ankle and foot up towards the knee. So we would get the tibia to turn inward. That's why you would want to max out that tibial translation. The easiest way to do that is with forefoot elevated. That way I don't push down through the midfoot to create the IR compensatory strategy. I'm going to get an active tibialis anterior that's going to control the foot so you can't push down through the midfoot. I got to call it there, everybody. I appreciate everybody who is watching on YouTube, as well as those of you on the network. This is going to be posted up on the network, and we'll be on there for our regular content and Q&As. We got the coffee calls coming up on Thursday, 6 a.m. Eastern, and then access to UHP Plus should start this weekend.